I feel like I should be like the opposite way. I feel like I should be the opposite way for some reason. Hold on. Hey, y'all. Hey. Okay. While y'all are getting it together, I'm gonna get it together. Hold on. I think it'd be better if I was like this way. I knew it. She's glowing. Hey, y'all. Okay. Hold on. Oh, shit. 1 second. We're just gonna move this. 1 second. Hold on. All right. She's in DC for white coats and cocktails. That's where she is. She's not home. All right. I think this is a much better. We're good? All right. Hey, y'all. Hey. Hey, hey, hey. All right. So if you are here for NCLEX Jeopardy, please make some noise. Okay, type. Type that you're here. Let me know if it's your first time. Let me know if you are a repeat offender, if you've been here before. Let me know if you've joined me for NCLEX Jeopardy before. Oh, let me show y'all what it is. 1 second. Let me bring it up on the screen so you'll know what the hell we're doing. All right. This is what we're doing. NCLEX Jeopardy. All right. This is our live, free, and fun Jeopardy review. Oh, I forgot my hair was still up. My bad. Okay, whatever, it's gonna stay. But yes, this is our live, free, and fun NCLEX Jeopardy review for NCLEX RN or NCLEX PN. The information is used and tested on both, okay? Oh, hey, all my first timers. Hey, all my first timers. All right, hold on, who do I have? Bree, Yvonne, Sincerely Me, Redhead, I'm Just Nee, Miss Jam, Comfortably Yours. Hey Lydia, welcome back. Hey Yari, welcome back. Hey Lauren, of course, welcome back. First timers, it's Jalen, Chubby Cheeks, Pink, PY Tink, what's up? Chance Dion, what's up? Shadur, awesome. So this is NCLEX Jeopardy, and just like regular Jeopardy, you have your blue screen, you have your categories. We have 5 categories and 5 questions per category. That's how we're going to play our version of Jeopardy. This is NCLEX Jeopardy / nursing school Jeopardy, whatever. Okay, because I always say as soon as you get into nursing school, on day 1, you need to be preparing for the NCLEX. So it doesn't matter if you have your NCLEX, if you don't have your NCLEX scheduled, or if you're not even in that same year that you're going to be taking NCLEX. This is going to be of use for you, okay? The sooner you review, the better and less overwhelmed you're going to be when you have to review for it your last semester, okay? All right, so these are our categories for today: pharmacology, pediatrics, mental health, fundamentals, and adult health. Hold on. Okay, I had to put my own thing. Yep, these are our categories. We have 5 questions per category, ranging from 100 points to 500 points. Okay, how we're going to play is that every man is going to be for his or herself. Okay, we're going to have a scoreboard. That's going to be our scoreboard. And the person that answers correct will correctly first. Yeah, the first person that gets the correct answer and is first on my screen is going to be the person that wins those points. So and of course it is Jeopardy style, so you have to say what is whenever you are answering, okay? So little tip, you might as well go ahead and type what is in the comment, copy and paste it, so that when you're about to answer, all you got to do is press paste and then say whatever your answer is. All right, our answers are going to be multiple choice, so they're going to be 1, 2, 3, or 4. So you would have to say what is 1, 2, 3, or 4, whatever your answer is going to be. All right, once again, the first person on my screen is going to be the winner of those points. Just in case there's some lagging and you see a name or your name above someone else's, and it's not what's matching my screen. I can't go by your screen. I can only go by mine. It's okay. Does not matter. Well, if in the game, it matters if you're first, just because we're playing for incentive. The person with the highest number of points will win a free Ultimate Nursing School bundle. Okay. If you answer correctly, but you do not answer first, or if you don't say like what is. If you don't really care about the points, whatever. It doesn't matter. If you're just here for the review, awesome. Just make sure you're answering the question correctly, okay? Because on the actual NCLEX, it is not Jeopardy style. You don't have to say what is. You don't have to be first. That doesn't matter. As long as you get the answer correct, it means that you're comprehending the material, which is what they want, okay? All right, so if y'all have any questions, let me know. Type it down below. Either me or a seasoned vet will answer. If not, we're going to go ahead and get into it. Okay, so first question. Let's go ahead and go. Let me make sure I have my handy dandy scoreboard. Let's go ahead and get into our first question, guys. First question. Let's go with since this is week 2 of Camp Nursing School and the objective of week 2 is to learn the basics. Let's go ahead and go back to the basics of nursing. Let's do fundamentals for 300. All right, this is your question. Note, you do not have to wait for me to finish reading the question for you to answer. When you read it and you fully understand what the question's asking, you feel like you have the correct answer, go ahead and drop it. Make sure you say what is if you care for the points. All right, so fundamentals for 300. The nurse is creating a plan of care for a client scheduled for surgery. The nurse should include which activity in the nursing care plan for the client on the day of surgery? 1. Avoid oral hygiene and rinsing with mouthwash. 2. Verify that the client has not eaten for the last 24 hours. 3. Have the client void immediately before going into surgery. Or 4. Report immediately any slight increase in blood pressure or pulse. Let's go back to that question. Test taking tip for all my first timers. Whenever you have a nursing school question, NCLEX question, honestly, any type of question, you want to read the whole thing through. You want to read the question, you want to read the answer choices, and then my tip is to go back and at least read the last sentence, because usually the last sentence of the question is the actual question. It's what they want from you. Okay, so I just read the whole thing. Let's go back and remind ourselves of what the question is asking so we can know what we need to answer, okay? The nurse should include which activity in the nursing care plan for the client on the day of surgery, okay? I'm seeing lots of what is twos, which is verify that the client has not eaten for the last 24 hours. Seeing some what it's fours. All right, let's go ahead and see what the answer is. And the answer, drum roll please. Somebody put a drum roll emoji. And the answer is, what is 3? What is 3? Have the client void immediately before going into surgery. All right, this is the rationale, guys. The nurse would assist the client to void immediately before surgery so that the bladder will be empty. Okay, oral hygiene is allowed, but the client should not swallow the water. This is the important part. The client usually has a restriction of food and fluids, right? So they're usually NPO, but that's usually for about 6 to 8 hours, all right? Or longer, but it's as prescribed, okay? Who not eating for a whole 24 hours? Are we fasting? Is this a religious type of surgery? Who is fasting for 24 hours? It's usually like nothing to eat after midnight, and they have like an 8 a.m. surgery or a 6 a.m. surgery. That's usually what it is. I know it feels, especially if you're the person that can't eat right before surgery, it feels like 24 hours. I promise you. It feels like 24 hours, but it's only 6 to 8, okay? It says a slight increase in blood pressure and pulse. That's common, all right? That's during the preoperative period, and it's usually the result of anxiety. You're about to go under. Remember, stress and anxiety makes your blood pressure and pulse both rise, okay? Gets that heart going, all right? So let's see what that answer, well, not what that answer is, but let's see who answered first and correct. Who said what is 3? Bree Sam. That is Bree Sam TZ. Congratulations. All right, so you're on the scoreboard with 300 points. Who else got what is 3 but weren't first? It's fine as long as you get the answer correct. Let's see who also got the answer correct. All right, so Bree was first. Snaps for Bree and 300 points. Who else? Going, keep going. I think that was the only person. It's okay. It is okay. It is okay. First, it was not a clear question. It didn't tell you the type of surgery. It doesn't matter the type of surgery. No one's going to starve them for 24 hours. That's not the protocol. 6 to 8 hours, no matter the type of surgery. If it's longer, then they'll let us know, but it still won't be 24 hours, I promise you. AV88 also got it. Great job. I would have thought vitals would be more important. But remember, they said a slight increase in blood pressure. All right? A slight increase in blood pressure and pulse. They are nervous AF. Okay? That's usually anxiety, especially because it's slight. If it was a huge jump, then that word slight wouldn't have been in there. Chubby Cheeks got it as well. Great job. This answer was a surprise. It is okay. That's why we are doing this review. So we can, wait, this is falling. Boom. Okay, sorry. But yeah, if you got the answer wrong, it is okay. Like I say all the time, I'd rather y'all get the answer wrong in front of me and a bunch of other folks on Instagram so you can learn from it, so that on the actual day when you're taking the NCLEX, if you come across something like this, you'll be like, I kind of know about it already. I've already been through this. So now my way of thinking is going to be a little bit different because you've had this experience before. Once you get a question like this wrong, that's why I would say practice is amazing. Once you get a question like this wrong, you'll very rarely get it wrong again. Like, it's one of those things like, ooh, I got, but I will not get got again. You won't get me again. It's those type of things. Okay, who else got it? Is this Camp? Hey, Ashley. This is, we do this NCLEX Jeopardy every Thursday. At 7 p.m. This is just a part of one of your camp activities for camp for those that signed up, but it's also for anybody that wants to review, to be honest. All right, let's go. My fault. I pressed mute again. My bad. Okay, let's go back. The nurse is evaluating goal achievement for a client in traction with impaired physical mobility. The nurse determines that the plan of care needs to be revised if which outcome is noted. 1, intact skin. 2, bowel movement every 4 days. 3, active range of motion of uninvolved joints. And 4, absence of redness and swelling in the affected extremity. What is our answer? Remember my test taking tip, go through it one time and then go back up to the last sentence so you can be reminded of what the question is asking you. The nurse determines that the plan of care needs to be revised if which outcome is noted. Okay? Remember, we have a client in traction and they also have impaired physical mobility. Okay? So we're looking for the outcome. All right, if it says that the plan of care needs to be revised if which outcome is noted, that's another fancy way of saying you're looking for a unwanted outcome. Okay, you're looking for an outcome that does not improve the patient's condition. Okay, let's go ahead and let me scroll back and see what y'all saying. Redhead said, are you going to go through everyone who got the question correct or wrong before we proceed? I'm new here. I'm just wondering. Yes, I shout out everybody that is participating, but they got it right And if they have any questions, we answer the questions as well. All right, so the answer, let me scroll back up to y'all answers, and then let's go ahead and answer what the correct, or bring up the correct answer. This was adult health, and the answer is, what is 2? Bowel movement every 4 days. All right, bowel movement every 4 days. A bowel movement every 4 days is insufficient, okay? What's another word for that? If we had a bowel movement every 4 days, what's another word for insufficient bowel movement? Give me another word for that. All right. The client should be having a bowel movement a minimum of every other day. Okay. Expected outcomes for impaired physical mobility for the client and traction include absence of thrombophlebitis, redness and swelling in the affected extremity, active range of motion to uninvolved joints, clear lung sounds, intact skin, and bowel movement every other day. All right, those are expected outcomes. Those are our goals. That we want those things to happen. Okay, but bowel movement every other 4 days, that is not ideal. That's not ideal. We gotta incorporate some other things. Okay, first person to get what is 2 is Nay 42. Great job, Nay 42. Nay with 3 E's underscore 42. You are on the scoreboard with 300 points, and you are tied with Bree Sam. All right, who else got what is 2? Teeter Trotter, Nurse Lori, Vian, Emera, Tori Lynn, Payroll Fresh, Monique Fessler, Wildflower, K-Jo, Victoria, Lisa, Lucky One, Ken Brella. For anyone that's just coming in, remember to put what is when you're answering the question. Wamathai, 1, 2, 3. Lily, great job. No problem. All right, so yes, a bowel movement every 4 days. That's a great and fancy way. That's a care plan way of saying you're constipated. Okay, remember, I don't know if you guys have started nursing school yet, but they really stress not using medical diagnosis. Constipated is a medical diagnosis. As a nurse, in our scope of practice, we cannot medically diagnose anybody. What we can do, all right, is use a nursing diagnosis, all right, and that would be insufficient bowel movement. It's just another way of saying it within our nursing scope of practice. So great job. Everyone said constipated. Poor or inadequate. Yeah, BMs. Great job. Let's go ahead and get to the next one. What was this? Adult health for 300. What is our next? Let's do mental health. Make sure I didn't mute myself. Mental health for 200. The nurse caring for a client diagnosed with severe depression is planning activities for the client. Which activity would be most appropriate for this client? 1, drawing. 2, playing checkers. 3, painting by numbers. 4, putting a puzzle together. Let me scroll back up. I didn't see you, Bree, but let me just double check though. Let me check while you guys are answering what this question is. It was name, yeah, it was name 42 for me. I don't think yours came through. Yeah, I don't see yours for some reason, Bree, but that's okay. At least you got it right. Woohoo! I'm looking to see what you guys are saying. All right, which activity would be the most appropriate for a client that's been diagnosed with severe depression? Okay, severe depression. Let's go ahead and look at what that answer is. Mental health for 200, and the answer is, what is 3? What? 1? Drawing. What is 1? Drawing. Concentration and memory are poor in severe depression. When a client has a diagnosis of severe depression, the nurse needs to provide activities that require little concentration, such as drawing. I don't know what kind of drawing y'all doing, but I gotta be concentrating when I'm drawing. But anyway, activities that have no right or wrong choices and that require no decisions minimize opportunities for the depressed client to experience a sense of failure. The remaining options do not meet the criteria and are incorrect. Okay, so who got what is one? Quite a few of you. Woohoo, great job. Monique Fessler got it first. Let's go back up and make sure. Yep, Monique Fessler got it first, so congratulations. Let me put you down before I forget. Y'all know I'm ADHD. I will forget. Monique Fessler. Welcome back to the scoreboard. Who else got it? What is one? Wallflower, Bree Sam, Vian, Pretty Nikki, Lily, Pretty Jazzy, Britt B, Miss Shoddy, Pretty Nikki, FFBRZ, Kiss My Dimples, Exo Suri, would coloring without numbers qualify? Honestly, that's what when I chose it, y'all know, I will let y'all know if I get a question wrong. When I chose this, or when I was going through this, I got this question wrong. I chose coloring by numbers. Like it's literally telling you what to draw. Or color in. Drawing, you know how hard it is to draw? I drew all of this, like all this down below. Like I do that. My study kits, I draw those. Like it is not easy. It is not easy, and it creates a huge sense of potential failure. Especially I'm like, oh my God, what if my followers? What if you guys, my supporters? What if y'all don't like it? Like the sense of failure. What if it's not cute enough? So that was but that's what happens when you put your own personal spin on some questions. You're not really supposed to, for NCLEX at least, you're not supposed to like put your experiences in, because everyone has a different experience. So NCLEX is going to be by the book. Okay, this is NCLEX Hospital. It's perfect in NCLEX Hospital. It's fully staffed. Okay, everybody loved working there. Nobody talked bad about each other. Like it's the perfect world. That's how when NCLEX is asking you a question, it's asking you to put that in or think about it in a perfect world, I guess. And not put not perfect world, but just don't put your personal experiences in there. And that's exactly what I did for this question. I didn't put drawing because right. Teddy Bear Love you went dark. Teddy Bear Love went dark. She said, I thought they'd harm themselves with the drawing and writing utensils. You went dark real quick. All right. Yeah. That technical. I promise you, it's insane, because a lot of people, you have to put the best answer, the most appropriate answer. So it's not necessarily a right or wrong. It's like, which one is the most right? Which one is the least wrong? Like it's that type of stuff, because when you actually get critical thinking wise, when you get into the real NCLEX world or nurse world, it's slick like that. Like you never know what you're going to get. So that's what they're doing. All right, next question. I gave points, right? Yes, those. Yep, mental health. Okay, let's go to our next question. Peds, 300. The nurse is reviewing the laboratory results for a child scheduled for a tonsillectomy. The nurse determines that which laboratory value is most significant to review. 1, creatinine level. 2, prothrombin time. 3, sedimentation rate. Or 4, blood urea nitrogen level. What is our answer? Don't forget to say what is if you're playing for points. If you're just playing for the review, then just tell me what you think it is. And we're going to go over the detailed rationale after. All right, I'm getting lots of 2s, which is prothrombin time. Lots of 2s. All right, let's go ahead and see what that answer is. When you're going through your own review, whether it's with me or with another group, you want to aim for spending no more than about 60 seconds per question. That's reading it, reading the answers, think about the answer, and choosing the answer. All right. The last thing you want is to, on top of being nervous about whether or not you pass the NCLEX and whether or not you're answering the questions correctly, you're also going to be nervous about whether or not you're going to run out of time. So just eliminate that fear and just practice now. Practice makes progress. Okay. All right. So with everyone saying like 2, so we're either all right or we're all wrong. But we in this together. Let's go ahead and see what the answer is. P's for 300, and the answer is, what is 2? Ooh, we all right in this piece. Great job. All right, so let me scroll to see who said this first. And it's Lexi is the first person to say it's 2, but once again, on the NCLEX, it's not Jeopardy style. They don't care who's first. As long as you answer that thing correct within the amount of time allotted, you get them points. Okay, so great job to Lexi. You now have 300 points, which means you are tied with Nay and Bree for first place. And in Monique, you are right on their tails with 200. All right, we still have more questions to go for anybody to either catch up, get on the scoreboard. Okay. Who else got what is 2? Pretty much everybody. Wama, Smiles, It's Me, Sarah, Vian, Nicole, Ari Staples, NC Pink Rose, D Bant for Bree Sams, Tori Lynn, Giselle, Kevin Mommy, Blessed 185, Redhead, Queen, Pretty Jazzy, Lucky One, Just Daedra, that's cute, Celia, Kiss My Dimples, Celia 101, Sashay. Great job. I didn't see your answer. Take it personal. I promise it was it's Lexi. Just in case y'all are coming on, I can just in case I would literally just want to say it again, but just in case y'all are just coming on, Instagram sometimes with your connection and maybe like a little bit laggy, so someone else's answer shows up on my screen before it shows up on yours, or sometimes it doesn't even come through. I don't know what happens with that. I'm not in IT. I'm not sure. But remember, this is just a fun review. You're not supposed to like get all wound up about it. And it's just a fun review. We do these literally every Thursday. Okay, so if you want that chance to win another study guide or even get the answers correct, you can come back next week or download the app and you can play the rest of the questions. But remember, this is just to make it just fun and free and just a group experience. So just in case someone knows something that the other person doesn't know, we're learning something together. Okay. All right. So the answer is what is 2. Once again, it's Thrombin Time. So a tonsillectomy, and I just posted something about like med abbreviations, prefixes, and suffixes, like the common ones. All right, if you're just about to start nursing school, you need to know these common med terms and abbreviations. So tonsillectomy. Ectomy means surgical removal. Tonsil is the tonsils. Therefore, tonsillectomy is a surgical removal of the tonsils. All right, so that's the procedure that they had. Because the tonsillar area is so vascular, post-operative bleeding is a concern. So prothrombin time, or partial thromboplastin time, or platelet count, hemoglobin, and hematocrit, white blood cell count, and urinalysis, those are all performed preoperatively. Those are usually like the pre-op labs that they draw to make sure that your body is in homeostasis and you good, you got all your platelets so you don't bleed out, all those things. Prothrombin time, that would that specific test that would identify a potential for bleeding. Okay. I'm not even gonna ask that question because I don't even know. I was gonna ask, do you know the normal prothrombin time? Let's learn it together just in case, right? What's normal prothrombin time? First person to answer correctly gets 100 points. Prothrombin time, normal range. Let's learn something together. Or I'm learning something. Thrombin time. Okay, I have my answer. It says 10 to 13 seconds. And I'm sure based on whoever lads, it may like vary by a few seconds or something like that. But 10 to 13 is what I got right here. Let's see who said it. Yes, you can. 9, 2. Nicole said, isn't it like 2? That's INR. I know, I get that mixed up too. 20 seconds, just a guess. 1.5 to 2.5, 2.5 to 1.5. Bree Sam said 12.5 seconds. She's the closest. But yes, it's 10 to 13 seconds. Okay, prothrombin time. Yeah, I know. You need to know the difference because listen, if I lack in something, I'm going to tell y'all, all right? PT and INR, I get those mixed up to this day, okay? So make sure you know the difference between PT and INR and make sure you know the normal range for PT and INR, okay? Right, PT, INR is it together. Those are separate things. All right, both of those help with, both those are tested, especially preoperatively before surgery. But that PT-INR is made up of 2 different labs, PT and INR. Okay, all right. So Bree Sam, you got that. You were the first person to get closest to that. So you just got an extra 100 points. So you now have 400 points. Okay, great job. All right, next question. Right? Aren't we all learning? See, this is why you should come to NCLEX Jeopardy every week. You learn something new every time. I know I do. All right. That don't mean I won't forget it by the next time we come around, but that's not the point. This is for y'all. All right. So let's do, what was that? Peds? Let's do farm. Pharmacology for 400. All right. A clinic nurse is performing an assessment on a client with rheumatoid arthritis who has been taking acetylsalicylic acid for the disorder. The nurse assesses the client for signs of aspirin toxicity. Which findings should alert the nurse to the possibility of toxicity? 1. Fever and signs of hyperventilation. 2. Constipation and abdominal bloating. 3. Client complaint of visual disturbances. 4. Abdominal discomfort and client complaint of diarrhea. All right, remember, go back up so you can read in the last line so you can be reminded of what they're asking or what they want you to answer. Which finding should alert the nurse to the possibility of toxicity, of specifically aspirin toxicity? All right. So we are looking for which option, 1, 2, 3, or 4, which option is a sign of aspirin toxicity. So that's what we're looking for. Okay, test taking tip. Whenever you see whenever you see an answer choice or 2 answer choices that are opposite of the other, that's a hint. Okay. For example, 2 says constipation, and then 4, you have diarrhea. All right. Now, when it comes to answer choices that have 2 things, like constipation and abdominal bloating, it's very important. You got to make sure that both of those words apply to the situation or apply to the correct answer. All right. So if constipation is one, but abdominal bloating is not, then that's not the answer. Okay, but constipation, diarrhea, those are opposites of each other. So usually when you have opposites, that's one of them is usually the answer. You feel me? All right, let's go ahead and see what the answer is. What's this again? Farm, right? Boom. All right, so fever inside. Oh, I think I baited y'all. I wasn't saying ooh. Okay, no. I stand by what I said. Remember, both of them have to apply. Okay, so What is one? Fever and signs of hyperventilation. All right, so mild intoxication with acetyl salicylic acid, all right, or ASA, that's called salicylism, and can be experienced by the client when the daily dosage of aspirin, girl, that's aspirin. ASA, that's aspirin. So I'm going to say aspirin because I'm not doing this with y'all. It's experienced by the client when the daily dosage of aspirin is more than 4 grams. Tinnitus, which is ringing in the ear, that's the most frequent effect noted within aspirin intoxication. Okay, I'm gonna read that one more time because I hope y'all knew that. I hope y'all know that. Tinnitus, ringing in the ear, that is the most frequent and the most noted sign or symptom of aspirin intoxication. Okay, it says hyperventilation may occur because hyperventilation may occur because salicylates stimulate the respiratory center. Fever may result because salicylates interfere with the metabolic pathways, coupling oxygen consumption and heat reduction. Girl, what does that even mean? The remaining options are not signs of aspirin intoxication. I'm not even doing this with y'all today. I'm not doing this. Okay, did y'all understand that? I hope so, because I didn't. All right, so fever and signs of hyperventilation. Remember, whenever you have option choices, whatever, that are 2, you have fever and signs of hyperventilation, they will look at both. Okay, make sure you are looking at both, because you'll mess around and the real thing will be fever and signs of like hypoventilation or something like that. They be tricking you like that to make sure that you're paying attention. Okay, critical thinking. All right, next question. Wait, let me see what y'all saying. Y'all make me laugh. Redhead said, let me get back to you, work, because that is okay. Practice makes progress. Don't do that. Don't beat yourself up, Redhead Carmel. Because you was getting some questions right. I was reading your answers. All right, so let's see who got this answer correct. Let me scroll. So the answer is, what is one first person to get it? A lot of people said what is 4 and like what is 3. I don't know. What's the answer? What is 1? Buddha flee. Oh, like beautifully. Great job. Buddha. Are you on the scoreboard with 400 points? And you are tied with Bree Sam for first place. Great job. Who else got it? You Love Neek, Tashana, Take It Personal, FFBRZ. Lauren said, I thought it said bleeding. What? It's Joyce Jasmine because of the fever. Great job. It's okay. Like I say, if you don't get these answers correct, especially I'm sorry, my fingers was too fat. All right, I'm trying to change the picture and I kept muting myself. But yeah, don't beat yourself up. Okay, but as long as you're getting the answer correct, it don't matter if you're first on here or not. What was this? Farm? Yes. So let's do adult health, guys. The nurse is assessing a client newly diagnosed with mild hypertension. Which assessment findings should the nurse expect? 1, asymptomatic. 2, shortness of breath. 3, visual disturbances. 4, frequent nosebleeds. Which assessment findings should the nurse expect with the client newly diagnosed with mild hypertension? One thing I want to let y'all know about the NCLEX is that they mean every word. Okay, every word they type, they mean it. So mild is different than severe, which is different from moderate. Like, they don't just throw words in there that they don't mean. All right, if you have an adjective in front of a word, pay attention to that, okay? So which assessment finding should the nurse expect? 1, 2, 3, or 4? Let's look and see what our answer is. What is 1? Asymptomatic. Ooh, 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 ooh. Look at you. Ooh. Asymptomatic, guys. All right, let me scroll up. You are not about to fail the NCLEX redhead. Stop it right now. I didn't see you, Lexi. Your answer. What's the answer? What is 1? Future ER nurse got this one first. Hey, future ER nurse. Future ER nurse. You're on the scoreboard with 100 points. Who else got this one? What is 1? D Band 4. Monique Fessler, Bree Sam, Smiles, Tashana, Wama, Beautifully, Ari Staples, Applejacks, It's Only Me, Take It Personal, Thick Thighs, and Peaceful. Tina, Queen Whitkin, Sashay, great job. Great job. Okay, so yes, it says the answer is what is 1 asymptomatic? All right, hypertensive clients. Hypertensive clients have no symptoms until target organ involvement, which happens with very high blood pressure. This is why it is often noted as the silent killer. All right, the remaining options are incorrect because those clinical manifestations occur with severely high hypertension. Yeah. What did I say? Severe, mild, those are all, they all mean things. Words mean things, especially on the NCLEX, okay? So, now you know. As George Jasmine said, I'm writing all these down. Good. That's the whole point. Make sure. Remember, once you get got, you're not going to get got again. All right, next question. Let's go back to fundamentals. All right. The nurse is preparing a continuous intravenous infusion at the medication cart. As the nurse prepares to attach the distal end of the IV tubing to a needleless device, the tubing drops and hits the top of the medication cart. Which is the appropriate action by the nurse? 1. Change the IV tubing. 2. Attach a needleless device. 3. Wipe the tubing port with betadine. Or 4. Scrub the needleless device with an alcohol swab. Which is the appropriate action by the nurse? All right, let's go back through what happened here. All right, we're preparing to give an IV infusion of let's say it's, I don't know, an antibiotic or something like that. Let's say it's like Zosyn or something like that. So we go to prepare the distal end. Remember, distal means distant. That's all right. It's the furthest point. All right, it's the most distant, distal. All right, it's the most furthest point of the IV tubing. We're trying to attach that to a needleless device. Okay, so like one of those lure lock things. The tubing drops. Oh shit! Oh no! And it hits the top of the medication cart. The top of the medication cart. Where did it fall and hit? The top of the medication cart. Just want to make sure y'all know. Yeah. Which is the appropriate action by the nurse? Let's go and see what our answer is. Fundamentals for 200. What is change the IV tubing? Change the IV tubing, guys. All right, the nurse should change the IV tubing because it has become contaminated, all right, and could cause systemic infection to the client, all right? It didn't fall. It doesn't matter if it fell on the floor. It doesn't matter if it fell on the side of the cart, on the bottom of the cart. At the end of the day, it fell and hit a non-sterile environment. Even the top of the medication cart, don't let that trick you. Even the top of the medication cart, that IV tubing has to be sterile, not clean. It has to be sterile. There's a difference. Okay, the only thing sterile is it literally in a sterile environment. Okay. It says wiping the port with betadine. That's that brown stuff. B for betadine for brown. Sorry. Wiping the port with betadine is insufficient, all right, and would be contraindicated in any case because the tubing will be attached directly to an angiocatheter in the client's vein. The needless device has not been contaminated and does not need replacement or cleansing. So that's why the answer was incorrect. All right, so the answer was, what is one? Change that tubing. Babe? Is that housekeeping? I don't know. Sorry. Wait, what were we saying congratulations for? Baby Assad, you passed! Oh my God! Wait, screenshot. Okay, I just want to screenshot that. Great job! Wait, did I get it? No. One more time. Okay, one more time. All right, and cheese. Okay, great. Man. Let's see who got. Congratulations, baby Assad. Great job. All right, let's go and see. Let me scroll back up to the top, the very tippy top. Just see who got this one there. What is one? First person to get that right was Wildflower. Great job, Wildflower. You now have 200 points. Who else got what is one? Teddy Bird Love, Bree Sam, Nay, 42, Joanna, Lauren, Take It Personal, It's Lovely, Beautifully, Payroll Fresh, It's Only Me, Tashana, 4B, Kiss My Dimples, Giselle, It's Joyce Jasmine, Alexis, Aquarius Goddess, Queenwood Cat, Sashay, Future ER Nurse, Bye Lauren, or Brandon's Bride, One Nevermind One, Nicole, I Am the Ambitious One, Applejacks. Great job. All right, guys, next question. I did it again. One more time. I think this is the last question, and it is. All right, last question, and it is PEDS for 500. All right. The clinic nurse reads the results of a tuberculin skin test, TST, on a 3-year-old child. A 3-year-old child. The results indicate an area of induration measuring 10 millimeters. The nurse should interpret these results as which finding? 1, positive. 2, negative. 3, inconclusive. Or 4, definitive and requiring a repeat test. What is our answer? We are trying to interpret these results. All right, what are our results? Our results were we have an area of induration measuring 10 millimeters on a 3-year-old child. These results would be classified or interpreted as what? Positive, negative, inconclusive, or definitive and requiring a repeat test. What is our answer? All right, answer is positive. What is one positive? All right, who's the first person to get this? Teddy Bird Love. Teddy Bird Love is the first person on my list. All right, Teddy. You just got 500 points. Wow. All right, Teddy. Wait, hold on. Who else got it? After Teddy. Future ER Nurse, Take It Personal, Wallflower, Nicole, Deep Bant 4, Monique Fessler, Taj, Redhead, Real Spicy, I Am the Ambitious One, Healthy Mommy Hot Tamale, Caramel Cutie, Kiss My Dimples, FFBRC, It's Me, Sarah. Nicole, I see you telling me something right before. Don't go back and change that answer. You were right the first time. Blanca, Joanna, Nurse Jackson, Ray. Wildflower, you changed your answer. Just say Sam. You're not. Great job, Lisa, my boys. Wildflower said, "Oh my God!" See, never second guess yourself. But I tell y'all, each and every time. I didn't know this one. Now you know. We're gonna go over it. Now you know. See, that's why we go over this in NCLEX Jeopardy, because just in case you didn't come across this question, it's great practice. Practice makes progress. Okay. All right. So yes, in duration, it's measuring 10 millimeters or more is considered to be a positive result in children younger than 4 years of age. And how old was our client? 3. All right. So in duration, 10 or more is positive in our client since they're 3. This is positive in children younger than 4. Okay. It's also positive in children with chronic illness or at high risk for exposure to tuberculosis. Okay. A reaction of 5 millimeters or more is considered to be a positive result for the highest risk groups, such as a child with immunosuppressive condition or a child with HIV infection, which is an immunosuppressive, that's an immunosuppressive disease. So, my bad, I was about to talk shit. And then a reaction of 15 millimeters or more is positive in children 4 years or older without any risk factors. So a lot of you guys were kind of going backwards. You didn't remember. That's what I even repeated 3 years of age twice. I gave you a hint. 3 years of age. Okay. So 4 years and younger, positive is 10 millimeters or more. 4 years and older, it's 15 millimeters or more that it's positive. All right. Now, if it's 5 millimeters, then it's positive if they're immunocompromised. Okay. This starts at 7 p.m. on Thursdays. Got that wrong, but we'll never forget this now. I told you, once you get got once, it's very rare you get got again. Okay, but make sure you're paying attention. All right, so now when you go through and you do your other questions, or when you download the app to play the rest of these questions, we went through about like 8 or 9. There's 25. There's 25. There's 25. Okay, so we went through 9 of them. You have 16 more to go. All right, so make sure you download the app. I'm gonna upload it so you can have your the questions from tonight. But this is exactly why we do our practice. Okay, so hold on. I'm gonna give y'all just in case you need the link to download the app. Actually, it won't even matter. Once I get off live, just go to my page. Go to my page, and you'll see where you can download the app to play the full NCLEX Jeopardy mobile. And you can even search your Apple Store, your Apple App Store, or your Google Play. I don't know what you Android users use. Let me stop talking crap because my husband has Android and he gonna hear me. But yes, so make sure you guys tune in next week. We go over these every week as long as I'm alive and well and not sick or something like that. So sometimes when we don't have a live session, we'll at least have it in my stories, and every week you at least get the new 25 questions. Okay, the name of the app is the Nurse Sam. All right, then it's my app. It's the Nurse Sam app. Within it, you can purchase your study guide. So just in case you want like a fun, creative study guide that's made for visual learners, you can download that study guide. Or any of those study guides. The Ultimate Nursing School Bundle is what I recommend, period. But if you're here for, or if you're going into like teas or going to be taking the teas as well, we have a teas bundle that does really well. Those are our 2 bestsellers. All right. The Ultimate contains pretty much everything except for the teas, just because those are 2 separate tests. So if you want everything encompassed into one bundle, I recommend the Ultimate Nursing School Bundle. It covers first semester, second, and third. If you want to buy those individual bundles, you can, the $39 a piece, or you can get it all together for $97. Okay. Well, I'm not gonna lie, we having a sale. We about to have a sale, so don't even buy nothing right now. Give me like an hour so I can announce it. But we about to have a sale, so don't move. Don't spend all your coins. All right, so let me look through your questions. You have an app. I know. I do. This app is for y'all. Okay. Thank you, Queen Ken. That was sweet. This was genius. You're a real MVP for this. Thank you so much. Yes, we've been doing NCLEX Jeopardy for about 2 years. And I'm so glad that Baby Assad came and said that they passed their NCLEX, because we have people that have been literally coming to NCLEX Jeopardy for years, and it really does help them pass their NCLEX in 75 questions. So I just continue to do it for free because I want y'all to have that. I want y'all to have that weekly review, especially together. And plus, we have fun. Don't even lie, y'all have fun. Get thumbs up if you have fun and learned a lot. So give me 2 thumbs. Thumb 1 is I learned a lot. Thumb 2 is I have fun. How can you print the nursing bundle? You can go to printme1.com. That's the cheapest place that I recommend you get it. If you purchase the bundle, we give you an extra 10% off discount code to purchase your printed bundle, or to purchase the printing at printme1.com. You say hi. Aww. Yay. If you guys have not joined Camp Nursing School, registration is still open. Go ahead and sign up for Camp Nursing School. I'm getting you prepared for nursing school, basically. Whether it's your first semester, your next semester, you're like returning to nursing school, this is going to be our refresher course for the entire month of August. I am your camp counselor for Camp Nurse Sam. Camp Nursing School, that's the name of it. Camp Nursing School. The registration link is free and it's in my bio. Week 1 was last week, and we are in the middle of week 2. All right, if you are just coming on, you definitely want to sign up for week 2, because we do weekly giveaways, weekly camp activities, and this week's weekly giveaway, we're giving away 3 Littman stethoscopes. Okay, so a stethoscope is definitely going to be one of your nursing school supplies that you're going to need, and to get a good quality one, you're going to spend about $80 to like $100. So I wanted to go ahead and get that for 3 of you. So 3 of you will win a customized, because I want it to be a little fancy as well. All right, a customized stethoscope. 3 of you are going to win a customized Littman. I think it's like the 3M Littman Classic, whatever, the $100 one. 3 y'all winning that. Okay, so all you have to do to qualify to be in that giveaway, which is completely sponsored by me and me only in my pockets. Okay, Littman nor Instagram had anything to do with this giveaway. So, all right, let me say that. It's because I wanted to see you guys succeed, and I want you guys to have one less thing to worry about and to be as prepared as possible for nursing school. So all you have to do to qualify to be in that giveaway is register for nursing school. Register for Camp Nursing School. Registration link is in my bio, all right? Or you can just go to campnursingschool.com to register. Once you register, you are then in the drawing for every giveaway each week. Okay, remember, we are doing a giveaway each week, and there's 4 weeks we're doing Camp Nursing School. Last week, 3 people won a digital nurse life planner, because y'all know we ran out of the physical. We will not be restocking the physical. We will not be restocking the physical nurse life planners. They're going to be digital. We are, however, restocking study gummies and the LPN pens, and we're adding LVN pens and RN pens. So we're restocking those pens, and we're stocking study gummies instead of the nurse life planner, because y'all wanted those much more than the planner. So we're just going to do the digital version. Alrighty. So yes, campnursingschool.com, so you can register, so you can qualify for these wonderful week giveaways. This week, once again, week 2, we are learning the basics. That's why we did our we're learning med terms and suffixes, prefixes. I just made a post about that. Okay. We also, I think you should be on camp activity number 2. If you did sign up for Camp Nursing School, you should be doing camp activity number 2. Number 1 was the journal entry. Just tell me what's your fears? What are you so anxious about for nursing school? Like, what are you freaking out about? What stories have you heard? What do you want clarified? And then your second camp activity was the med terms and abbreviations crossword puzzle. So once you do that crossword puzzle, upload it to the link that was included in your week 2 schedule. And yeah, that'll be your camp activities for this week. Okay. Yeah, Camp Nursing School is at your own pace. It's a lot of information, and we do camp activities to make it interactive. So every week we kind of have like a schedule. Every Sunday we meet for camp assembly. All right, that's where we come onto Instagram Live and we talk about a topic or do a review or whatever matches for that week. This is week 2, so our camp assembly is going to be about the basics of nursing, and then we're going to get into actual nursing school content weeks 3 and 4. Week 3 is going to be fundamentals and health assessment, and then week 4 is going to be pharmacology and dosage calc. Okay, so we're getting everything kind of prepared for week 2, as we're getting everything prepared and getting you prepared for nursing school and getting your minds right, making sure you know your study, your learning style, so that when you do study, it's optimized for how you retain information. The camp does not cost. It's completely free. The camp does not cost. All you gotta do is sign up. The camp is completely free. The only thing that costs is if you want a study kit. If you want a study kit or bundle, you can, purchase that within our Camp Nursing School supplies, thenurseam.com. And yeah, other than that, it's completely free. Just make sure that you check your email so you can get all your links, so you know what to do as far as your agenda for each day of the week. The URLs, the camp activity URLs, and any type of information. I send out information as well that you need to read. So some good readings so you can be informed about something that you need to know in order to be successful in nursing school. Okay? All right, we meet online every week. Well, I want to say twice a week, because we meet online for NCLEX Jeopardy like we did today. That's every Thursday. And then we also meet online for camp assembly every Sunday at 6 p.m. Every Sunday at 6 p.m. we meet for camp assembly. That's our meeting every week. Other than that, throughout the week, it is self-paced. So you kind of know, once we get into week 3 and 4, we're going to be doing a little bit more and meeting more frequently. But this will be, for this week 2, we'll be meeting next on Sunday at 6 p.m. on Instagram Live for our camp assembly. We'll be talking about the basics. Okay? All right, guys. Make sure, if you're interested in that, it's free. Go ahead and just sign up and register. Just put your name and email, and you'll get an email to your inbox letting you know exactly what you signed up for, what to expect, and what to do for this week. Okay? Fundamentals is not like Med-Surg. It's two different things. Med-Surg is usually like in your second semester. For farm, if you need a bundle, I recommend the Ultimate Nursing School bundle because it has everything. All right, Ultimate Nursing School bundle has everything. All right, guys, don't forget to download this app. The app is the NurseSam app, so you can play the rest of these questions for NCLEX Jeopardy. I'm gonna go and update it so you guys can get a fresh 25 questions. All right, if y'all have any questions, go ahead and hit me up, and I will see y'all Sunday for Camp Assembly if you are registered for Camp Nursing School. And then I'll see y'all next Thursday at 7 p.m. for NCLEX Jeopardy right back here. Thanks for joining me. See you later.